Here's the superior vena cava. Now, we're gonna go out from the heart. Veins drain into the heart. We're gonna just go out. So when I say like this goes into this, we're going down the arm. We're going down the leg. All right, so it's counterintuitive, but just keep in mind like we're following it like the model works, okay? Here's the superior vena cava. Superior vena cava splits into, or has a split in from the brachiocephalic veins. Here's the right and left brachiocephalic veins. Brachiocephalic veins will split into the common should be common carotid, right? But on the venous side, these are going to be the jugular veins. So the brachiocephalic veins split into the jugular veins and the subclavian veins. Remember, carotid canal, jugular, foramen, right? So there's always opposites. Carotid, artery, jugular, vein. This is the internal jugular, okay? It's closer to the center. We also have these on the outside. These are the external jugular veins. Brachiocephalic vein, internal jugular, subclavian. On the subclavian, you have the external jugular. Good? Now, we'll go down to the arm. Did anyone learn it as like common jugular, internal jugular, external jugular? Someone should have learned it like that. You should have learned it like that, right? Yeah. No, he's wrong. He's like super wrong. And I've been calling him out on that for like years, and he's been like, no. So I'm like fed up with it. Go like tell him. It annoys me. Anyway, internal jugular, external jugular, subclavian. Now, the subclavian comes out, and it's going to split into the cephalic and the axillary. Axillary we saw over here. That middle pathway on the middle of the arm is going to be the exact same as the arterial side. Subclavian, axillary, brachial, radial, ulnar, palmar, arches. So on the venous side, it's arches instead of arch. The additional pathway we have is on the anterior, right? Which is over here, the cephalic, basilic, median antebrachial, median cubital, palmar, arches. Whatever, that kind of quick, right? This is what it looks like. So the reason we go over it a little slower. So this is what the arm looks like, right? On the model here. Now in reality, it doesn't look like this. It looks like this, right? So that pathway that's the same as the arterial side is on the posterior part of the arm, and the rest of the pathway is on the anterior. That posterior pathway, again, is the same thing we said before. Every time we split, it's going to become a new vessel. Posterior pathway is the same as the arterial side. That goes subclavian, which splits into cephalic and axillary. Axillary goes into basilic and brachial. Axillary, brachial, radial, ulnar, palmar arches. Good? The anterior pathway is the new pathway we're going to learn. And that goes subclavian, cephalic, axillary. Cephalic goes all the way down the hand into the palmar arches. Axillary goes down, splits into the brachial, which is the posterior pathway, and the basilic. Basilic also goes all the way down the hand into the palmar arches. Good? This little piece in the middle, this connects the basilic to this vein right here. This vein in the middle, this is called the median antebrachial. Antebrachial means front of the arm, so it's the forearm vein. This one that connects the basilic to the median antebrachial, this is the median cubital vein. Subclavian, axillary, cephalic goes all the way down. Axillary, brachial, basilic goes all the way down. Brachial, radial, ulnar, palmar arches. Basilic goes all the way down. Cephalic goes all the way down. And median antebrachial, median cubital. Subclavian splits into cephalic, goes all the way down. Axillary, which goes around the posterior. Axillary splits into brachial and basilic. Basilic goes all the way down and meets the cephalic at the palmar arches. Subclavian, axillary, brachial, radial, ulnar on the posterior, palmar arches. Cephalic, basilic, median cubital, median antebrachial. Palmar arches. We have an anterior and a posterior arch. So on the venous side, it's palmar arches. On the arterial side, it's palmar arch. Does that make sense? Mm-hmm. That takes some practicing. We'll get used to it. Okay, middle section. Kind of hard to make out, but essentially, whenever we have an organ, like the spleen, right, we have a splenic artery, we have the splenic vein right next to it. Here's the splenic artery, splenic vein. Superior mesenteric artery, superior mesenteric vein. Inferior mesenteric artery, inferior mesenteric vein. Renal artery, renal vein. Easy, right? Gastric artery, it's broken on this one, but the gastric artery, gastric vein, same thing. It's in the same loop. The difference is we have a celiac trunk, which goes into the hepatic artery, right? We don't have a hepatic vein. Instead, all of those vessels, the splenic vein, the inferior mesenteric vein, the superior mesenteric vein, right? Those are all going to collect into this region right here. This right here goes into the liver. This is called the hepatic portal vein. There are 3 trunks that come off of the descending abdominal aorta. Celiac trunk, superior mesenteric, inferior mesenteric. We don't have those for the venous side. Instead, all of those vessels, the superior, inferior mesenteric veins, the splenic vein, the gastric vein, all of those are going to collect into this hepatic portal, which is going to take blood into the liver. Does that make sense? Does that make sense? What's that?
That's the hepatic portal.
Okay, that's where these collect. See how the splenic and the inferior mesenteric collect right here? You see how these two collect in here with this one over also? That's this whole structure right here, the blue structure, that's the hepatic portal. Make sense?
Yeah.
You get the hang of it. It's technically it's easier than the arterial side because only one trunk, right? All of those collect into the hepatic portal, which goes into the liver. You can see this split from the posterior. It shouldn't be in here, but what happens, the hepatic portal goes into the liver. And if you look like from this angle where I'm looking, right? Now, there's a split in the liver of 2 little veins, 2 little blue veins. Those are the hepatic veins. Hepatic portal will go into the liver. Inside the liver, it'll split into the hepatic veins, and the hepatic veins will attach back into the inferior vena cava. Does that make sense? So all of those organs, all of those vessels, they do not go into the vena cava. They all go into the hepatic portal. The hepatic portal goes into the hepatic veins, and the hepatic veins go into the inferior vena cava. Does that make sense? Take some practicing, getting used to, but you get the hang of it. Now, there are 2 exceptions. The first one, renal arteries, renal veins. The renal veins go directly into the vena cava. That makes sense, right? Like they don't go through the hepatic portal. They just go directly into the inferior vena cava. Superior mesenteric artery and vein. If I lift it up, we can see right here the other exception, the gonadal veins. The gonadal veins are different than the gonadal arteries. Why? Because this here is the right, it's broken, but you can see the little piece that's broken off. This is the right gonadal vein. The right gonadal vein goes directly into the inferior vena cava. The left gonadal vein over here, instead of going into the vena cava, it actually goes into the left renal vein, and from there it connects into the inferior vena cava. So that, if you look again, you'll see it doesn't actually go into the vena cava. It goes into this vessel right here that comes from the kidney, left renal. Questions with that? So one more time. The middle section, like when you think about it, gets confusing. But when you look at it, it's pretty easy. Splenic, superior mesenteric, inferior mesenteric. Those all collect into the hepatic portal, which goes into the liver. Renal, right gonadal, left gonadal. Good?
Yeah.
Questions with that? Okay. Legs. Legs is almost the same thing as the arterial side. When we split, we get into common iliacs. Common iliac goes into external and internal iliac. External goes down, goes into femoral, which has a branch in the posterior, deep femoral. Femoral comes down. When it splits right here, it goes into the popliteal, which will then split into the anterior tibial, posterior tibial on the medial side, and a little green one right there. The plastic fell off, but that would be the fibular. Anterior tibial and fibular would go into the dorsal venous arch. Dorsal venous for veins this time, right? As opposed to dorsal pedis. Dorsal venous arch. Posterior tibial goes underneath the foot and goes into the plantar arch. Same exact thing as the arterial side, right? Questions with that? Now, you have two additional veins here, like the cephalic basilic, right? On here, when we split, right before we go into the femoral, we have this large vein on the medial side that goes all the way on the foot, and that's going to collect into the dorsal venous arch. This is called the great saphenous vein. On the lateral side, coming off of the femoral, before we go into popliteal, we have this branch that the deep femoral goes into. This branch down here on the lateral side, this is called the small saphenous vein. Does that make sense? Common iliac, external iliac, internal iliac. Common iliac goes into femoral. Start again, because I missed one. Common iliac, external, internal iliac. Off the common iliac, you have the great saphenous vein. The common iliac will become the femoral vein, which has a branch to the deep femoral. The femoral comes down and goes into the popliteal, also splitting into the small saphenous. Popliteal comes down, anterior tibial, posterior tibial, fibular. Anterior tibial, fibular. Small saphenous, great saphenous, all collect from the dorsal venous arch. Posterior tibial is the only one that goes underneath the foot, just like before, and goes into the plantar arch. Think posterior plantar. Make sense? Questions with that? Okay, last section. All right, this is one of the more difficult ones. Who's that model? Turn around. I'm just gonna move back. Okay. Back section. Lumbar arteries, lumbar veins. Easy. The little ones to point out. Now, those are the lumbar veins, but you also have the ascending lumbar veins. Coming from the common iliac on the posterior, there's a little wire that comes up right here and right here. These are the ascending lumbar because they bring blood from the lower back up, ascending. Ascending lumbar veins. Ascending lumbar is only the thin segment. So you see there's a thin segment and there's a thick segment?
Yeah.
The thin segment, up until about that line, is the ascending lumbar veins. Above that, on the right side, you have the azygos vein. Azygos, 59. So that azygos goes all the way up and it goes directly into the superior vena cava, right there. Azygos vein. This one right here. On the left side, you have the hemiazygos vein. Hemiazygos. Good? And the hemiazygos connects with the azygos vein by way of this vessel here and this vessel in the middle, this little bridge in the middle. This is called the accessory hemiazygos. One more time. Ascending lumbar comes up with a thin segment. Above the thin segment, thick segment, right side, azygos vein. Thick segment, left side, right here, hemiazygos vein. And connecting the hemiazygos to the azygos and the hemiazygos to the left subclavian, this little branch and this little branch form the accessory hemiazygos vein. Put a little line. If you connect those two pieces, you form a little upside down A shape, A for accessory hemiazygos. Good? Does that make sense? Questions with that? All the veins.